One of the most important decisions you'll make when you decide to have breast augmentation is which implant to use, saline or silicone. Because of all the hoopla that happened around silicone implants many years ago, I think often patients jump to saline because they think it's safer. And on the surface, it kind of seems like it. It's just salt water. But when you dig a little bit deeper, that may not be the case. This is a silicone implant. Silicone implants come to us pre-filled, and they've been used since the early 60s, and they rocked along just fine until the early 1990s when a media report suggested that silicone had all these problems, everything from breast cancer to autoimmune disease, and it really scared a lot of people. So the FDA took them off the market and put them under study. It's taken us over 16 years to get a new and improved silicone product back on the market to use. So long story short, during that 16 years, the National Institute of Health compiled a report that said none of those scary things can really happen, but that they didn't like that the implants failed too often. And that's really the chink in the armor that all the plaintiff lawyers found when they filed all those lawsuits, was that manufacturers and surgeons were not telling patients that implants don't last forever, that implants fail. So let's be clear, no implant lasts forever. It's a thing, and nothing lasts forever. However, the changes that they made during that study over those 16 years really gave us some new and improved products that are really good options for patients today. Two of the things they changed are the most important, I think. They made the silicone gel much thicker. It's highly cohesive, has more cross-linkers, it's more viscous than it was before, and when it's thicker, it doesn't have the opportunity to have as much gel bleed or leakage through the shell as it did in the early 90s. And by keeping it contained within its shell, then it helps reduce its capsular contracture rate. The second thing that they changed is that they added more filler to each shell. And by adding more fill, it protects the shell and keeps it from wrinkling and rubbing on itself, and therefore adds lifespan or longevity to each implant. Today, silicone implants also come with warranties, and it will vary depending on the manufacturer that you choose, but your surgeon should give you a booklet similar to this, and you should always keep these with your other important papers. On a lighter note, patients will always tell me that they prefer the feel of silicone over saline. We also find that silicone implants tend to weigh less on your tissue, therefore they age better with you over time. This is a saline implant. It comes to us empty, and it's rolled up something like this and inserted and then filled through this valve while it's inside your body. So a saline implant has to have a valve. So now we have two devices in one that can fail. So you have the valve that can fail and then the implant itself. And then you add to the fact that it's just filled with basically water, then you've got two primary reasons that the longevity of this device is not as long as a silicone implant is. One, it's filled with basically water, and two, it has a valve that can wear out. So the deflation rate with saline implants is quite high, and when it leaks, it's not going to hurt you, but it means that you have to have another operation. You have to go back into the operating room, more anesthesia, more time off work, recovery, and more money. Saline implants come with warranties too, but neither of these warranties is going to cover all of the costs associated with another surgery. We also find that saline implants don't age quite as gracefully as silicone because the nature of the filler, it tends to weigh more on your tissue and produce more sagging and stretch over time. And then that added weight, especially in thin patients, can cause more visible wrinkling. Saline implants tend to be less expensive than silicone, so that may be another reason why some people jump to them in the beginning. But if they end up costing you more operations down the road, are they really cheaper? During the 16 years that we had nothing to use but saline implants, Dr. Tebbetts put in about 6 to 8 saline implants a week. Now we see at least 3 to 4 deflations back a month. At least our patients knew this was a risk going in. They're not terrified when they just wake up with a flat tire. And we have a better option to offer them now. We have silicone. As a primary augmentation patient, you have a ton of implant options today that we've never had before. Fillers, shapes, shell types, profiles. Just be sure you thoroughly discuss each implant option with your surgeon and understand the pros and cons. Don't assume that something's safer or buy it because it's cheaper. Know the facts. If you found the information in this video helpful, please subscribe to our channel and tell any of your friends that are looking into any type of breast surgery about thebestbreast.com. Thank you.